The head-to-toe assessment is a cornerstone of nursing practice. It is a comprehensive evaluation of a patient's physical health. This assessment starts at the head and moves systematically down to the toes. Nurses use this process to gather crucial information about a patient's well-being. The head-to-toe assessment helps nurses identify potential health issues. It also allows nurses to monitor changes in a patient's condition. This systematic approach ensures that no area is overlooked. By detecting problems early, nurses can provide timely interventions. The head-to-toe assessment is a fundamental skill for nurses at all levels. Beginner nurses learn it as a core part of their training. Experienced nurses rely on it throughout their careers. Mastering this assessment is essential for delivering high-quality patient care. The information gathered during a head-to-toe assessment guides treatment decisions. It also helps nurses develop effective care plans. This systematic evaluation is crucial for ensuring that patients receive the most appropriate and timely care. Vital signs are like a window into a patient's overall health. They provide essential information about the body's basic functions. These signs include temperature, pulse, respiration, blood pressure, and oxygen saturation. Each vital sign offers valuable insights into a patient's condition. Temperature assessment reveals the body's core temperature. It is measured in Celsius or Fahrenheit. Nurses use various methods for taking temperature, including oral, tympanic, and axillary. Normal temperature ranges vary depending on the method used. Pulse measurement determines the heart rate. It reflects the number of times the heart beats per minute. Nurses commonly assess the pulse at the radial artery in the wrist. They also check the rhythm and strength of the pulse. Respiration assessment evaluates a patient's breathing pattern. Nurses count the number of breaths per minute. They also observe the depth and effort of each breath. Any irregularities in breathing are carefully noted. Blood pressure measurement gauges the force of blood against artery walls. It is expressed as two numbers, systolic and diastolic pressure. Systolic pressure represents the force when the heart contracts. Diastolic pressure reflects the force when the heart relaxes. Oxygen saturation monitoring determines the percentage of hemoglobin saturated with oxygen. Nurses use a pulse oximeter to measure this vital sign. A normal oxygen saturation level is typically above 95%. The head and neck examination focuses on these areas for any abnormalities. Nurses inspect the head for size, shape, and symmetry. They also examine the scalp for any lesions, tenderness, or signs of infestation. Eye assessment involves evaluating visual acuity and eye movements. Nurses check the pupil's response to light. They also inspect the sclera, the white part of the eye, for any discoloration. Ear examination includes inspecting the outer ear and the ear canal. Nurses use an otoscope to visualize the eardrum. They assess hearing acuity using techniques like the whisper test. Nurses examine the external nose for any deviations or asymmetry. They also inspect the internal nasal passages for any obstructions or discharge. The sinuses are palpated for tenderness. Mouth and throat examination involves inspecting the lips, oral mucosa, gums, and teeth. Nurses assess the tongue for color, texture, and movement. They also examine the tonsils and pharynx for any signs of inflammation or infection. Neck examination includes palpating the lymph nodes. Nurses check for any swelling or tenderness in these nodes. They also examine the thyroid gland for any enlargement or nodules. Thoracic and respiratory assessments are crucial for evaluating a patient's breathing and lung function. Nurses utilize a combination of techniques to gather information about the respiratory system. Inspection of the chest involves observing the chest wall for symmetry and movement. Nurses assess the rate, rhythm, and depth of respirations. They also note any signs of labored breathing, such as the use of accessory muscles. Palpation of the chest helps identify areas of tenderness or masses. Nurses gently press on the chest wall to assess for any abnormal sensations or findings. They also palpate for tactile phrenitis, which are vibrations felt on the chest wall while the patient speaks. Percussion of the chest involves tapping on the chest wall to produce sounds. By listening to the sounds produced, nurses can determine the density of the underlying tissues. Dullness may indicate the presence of fluid or a solid mass, while resonance suggests air-filled lungs. Auscultation of the lungs is performed using a stethoscope. Nurses listen to breath sounds in different areas of the chest. They identify and document the character and intensity of breath sounds, noting any abnormal sounds such as wheezes, crackles, or raunchy. Section 5. Evaluating the abdomen. Abdominal assessment is essential for evaluating the organs within the abdominal cavity. Nurses use a systematic approach to assess for any abnormalities or signs of dysfunction. Inspection of the abdomen begins with observing the contour and symmetry of the abdomen. Nurses look for any distension, scars, or visible masses. They also assess for any pulsations or peristaltic waves. Auscultation of the abdomen precedes palpation because palpation can alter bowel sounds. Nurses use a stethoscope to listen for bowel sounds in all four quadrants. The frequency and character of bowel sounds are noted. Percussion of the abdomen helps determine the distribution of gas, fluid, and solid organs within the abdomen. Nurses percuss for tympany, which is a hollow sound produced over air-filled structures like the stomach and intestines. Palpation of the abdomen is performed to assess for tenderness, masses, and organomegaly. Nurses use gentle pressure to palpate the abdomen systematically, starting with light palpation and progressing to deep palpation if tolerated by the patient. Section 6. Examining the extremities. Extremity assessment focuses on evaluating the circulation, sensation, and mobility of the upper and lower extremities. Nurses assess for any signs of circulatory compromise, nerve damage, or musculoskeletal abnormalities. Inspection of the extremities involves observing the color and temperature of the skin. Nurses assess for any swelling, edema, or signs of inflammation. They also examine for any lesions, ulcers, or varicose veins. Palpation of the extremities is performed to assess pulses and capillary refill time. Nurses palpate the radial, brachial, femoral, popliteal, dorsalis pedis, and posterior tibial pulses. Capillary refill time, the time it takes for color to return to the nail bed after blanching, is also assessed. Range of motion assessment evaluates the movement of joints in the extremities. Nurses ask the patient to perform various movements, such as flexion, extension, abduction, adduction, and rotation. They note any limitations in movement or signs of pain. Muscle strength testing is performed to assess the strength of muscles in the extremities. Nurses grade muscle strength on a scale from 0 to 5, with 0 indicating no muscle contraction and 5 representing normal strength. Section 7. Importance of a systematic approach. A systematic approach to the head-to-toe assessment is crucial for ensuring that no area is overlooked and that findings are documented accurately. This organized method promotes efficiency and consistency in patient care. By following a consistent order, nurses can develop a routine that becomes second nature. This reduces the likelihood of missing important details. A systematic approach also ensures that all body systems are thoroughly evaluated. Thorough documentation is essential for effective communication among healthcare providers. When nurses follow a systematic approach, they are more likely to document findings in a clear and concise manner. This promotes continuity of care. A systematic approach also helps nurses prioritize patient needs. By identifying the most critical findings first, nurses can address urgent issues promptly. This ensures that patients receive timely and appropriate interventions. Section 8. Practical tips for nurses. Performing a head-to-toe assessment can be enhanced by incorporating practical tips that promote efficiency and accuracy. These tips can be particularly helpful for beginner nurses who are still developing their assessment skills. Creating a checklist can be a useful tool for ensuring that all areas are covered during the assessment. The checklist should include all body systems and key observations to be made. This helps prevent omissions and promotes a systematic approach. Practicing the assessment on colleagues or classmates can help nurses improve their skills and build confidence. This allows for feedback and refinement of techniques. Regular practice is essential for mastering any nursing skill. Seeking opportunities to observe experienced nurses performing head-to-toe assessments can provide valuable insights and learning experiences. Paying attention to the techniques and communication style of seasoned nurses can enhance a nurse's own assessment skills. Continuing education courses and workshops focused on physical assessment can provide nurses with updates on the latest techniques and best practices. Staying current with advancements in assessment skills is essential for providing high-quality patient care. Section 9. Conclusion. The power of thorough assessments. In conclusion, the head-to-toe assessment is a cornerstone of nursing practice. It empowers nurses to comprehensively evaluate a patient's physical health, identify potential issues, and monitor changes in their condition. By adhering to a systematic approach, Nurses can ensure that no area is overlooked and that findings are documented accurately. This methodical process fosters efficiency, consistency, and effective communication among healthcare providers. Mastering the head-to-toe assessment is an ongoing journey that requires practice, observation, and a commitment to continuous learning. By honing their assessment skills, nurses play a vital role in promoting early detection, timely interventions, and optimal patient outcomes. The head-to-toe assessment is not merely a routine task, it is a powerful tool that enables nurses to make a real difference in the lives of their patients. By embracing a thorough and systematic approach to assessment, nurses can truly embody their role as patient advocates and providers of compassionate, high-quality care.